Well, it's 12:02, so I might get started. Warramee, everyone, which means hello in Darug, the land which I'm coming to you from today. I'd like to start today's webinar by acknowledging the traditional owners and custodians on the land on which I'm on today, the Darug people, and pay my respects to elders past, present and emerging, and also recognise their continuing connection to lands, waters and communities. And I'd also like to welcome any First Nations people joining us on today's webinar. We'd love to know the land you're joining us from today as well, so please feel free to tell us in the comments. We hope it's far and wide. And my name's Natalie Jurasic. I'm the co-chair of the SIMNA Western Sydney Committee, and I'll be co-hosting today's session with Maxine Morrison, who's co-chair of SIMNA's Sydney Committee. And as far as I'm aware, this is the first time that SIMNA Sydney and SIMNA Western Sydney have done a joint event like this, so we're really thrilled to be doing so. For anyone that doesn't know much about SIMNA and has kind of accidentally found themselves here almost today, SIMNA is a network whose purpose is to connect ideas, people and resources to help drive positive social and environmental impact in organisations and just as part of decision making. So it's a really broad church, and you'll often bump into, people from a whole wide range of areas in this space at networking events and events like this. And as part of that purpose, we're committed to sharing stories from those who work in this space, because we know there are a whole range of ways that you can approach social impact measurement, and it can be really tricky. So today we're bringing you two stories from two different for-purpose organisations working in Western Sydney, so the Woodville Alliance, but also in the Sydney CBD, Milk Crate Theatre. And it's really about showcasing their approach to tackling social impact measurement. We think they've got interesting stories to tell. And importantly, it's about how they got started as well, because that can often be one of the biggest challenges, knowing where to start. I'll let both organisations tell you a little bit more about themselves in a moment, but just a brief intro to our speakers today. So firstly, Liz Antoszkiw is currently the Child, Youth and Family Manager for the Community Initiatives team at Woodville Alliance, where she oversees their case management program. She's a social worker by trade and has a lot of experience in child protection statutory roles and intensive child and family support programs in Australia and also overseas. Jodie Wainwright is the CEO of the Milk Crate Theatre, and that's following a career in diverse roles in marketing, development and leadership for organisations like the Cancer Council, Sydney Opera House and the Red Cross. She was recognised as a fellow in the prestigious Social Impact Hub 2023 Fellowship, and also recently was honoured with the Business New South Wales Regional Prize for Outstanding Community Leadership in the Sydney metro area. Jodie is also joined by her colleague Jess Pantano, who's Impact Manager and who has over 11 years experience working in the arts, both in Australia and overseas, primarily as a producer, but also in acting, designing, stage management and also directing. She's completed postgraduate studies in human and community services at Sydney Uni after being inspired by some of her work with marginalised communities. So welcome and thank you to our speakers today. Just very brief housekeeping, which won't surprise you, but please keep your mics on mute whilst our speakers are presenting. But please feel free to ask questions in the chat. We welcome lots of questions because we've set aside some time towards the end of the webinar where our speakers will, welcome answering them. So I might start off by throwing over to Liz, who's going to give us a brief introduction to Woodville Alliance, but also talk about how Woodville got started on the social impact measurement journey. So over to you, Liz.
Thanks, Natalie. Hi, everyone. I'd also like to acknowledge the traditional custodians of the land on what we're meeting today. I'm meeting on Darug land, and I'd like to pay my respects to elders past and present and extend that respect to any Aboriginal or Torres Strait Islander people here at today's meeting online. So Woodville is a community-based organisation in Greater Western Sydney. The majority of our programs are in mental health, family and youth services, community development, disability and child early childhood education and care. And our service and referral footprint spans across 8 services, service sites covering 7 LGAs in Southwest Sydney and Western Sydney areas. Here at Woodville, we strongly believe in working partnerships with local communities, advocating for local issues so that we can support the clients and families we work with to live a fairer and more just society and improve quality of life. So as previously stated, I work for the Community Initiatives team, and this team's made up of managers, senior caseworkers, group and community coordinators, caseworkers, group and youth workers, community development workers, and admin staff. Our focus really is about providing early intervention support for children, young people and their families, and we do this in 3 distinct ways. Firstly, casework, where we will provide one-on-one support to a child, young person or their family to support mental health and wellbeing. Areas where we can provide support can include bullying, gaming, anxiety or behavioural concerns, school refusal, managing change, establishing routines in daily life, and emotional regulation and parenting support. Secondly, partnerships with schools, where we facilitate evidence-based groups in schools and community in an aim to strengthen children, young people and families' emotional wellbeing by helping build resilience. And thirdly, community development outreach. We're really passionate about the communities that we work with, where we can provide community events, supported playgroup, a music program, after school and school holiday activities with the purpose of strengthening the relationships that we have with the community. We also regularly run evidence-based parenting programs by qualified and experienced facilitators to support parents to strengthen their parenting practices. And for us, like local communities working with children, young people and their families who may not have been born in Australia, where their experience in coming to Australia saw conflict or violence or trauma, where there might be socioeconomic disadvantage and risk factors, where we're seeing poor mental health, family and domestic violence, poor access to basic needs like housing or food. The programs are funded by federal government, Department of Social Services, or state government, which is the TEI funding. So the way we work with clients and families is about how we strive to get the best outcomes. And we do this, and we know this by being evidence-formed or evidence-based. We know from research that if we can apply these practices, we can ensure better outcomes so that the dynamics within an individual or their family, they don't escalate. And that's the essence of early intervention. A big part of how we do that work includes collecting data. So it may be how really reflecting where that child or young person or family is at when they first start working with us, and then regularly completing those check-ins during that working journey with us, and at the end stages when we finish with working with a family. And with these funding contracts, we have KPIs where we need to meet a minimum requirement to show that we've worked with a certain amount of people, a specific type of client, and we use like a government data exchange software known as DEX to complete a range of different surveys or questionnaires. These can then feed into how we do our assessments and our case plans with families. But we also recognise that there's limitations of the tools that we use, and sometimes they can be really cumbersome and confusing, and sometimes they don't even feed through the accurate data. So we're often double checking, and that is time consuming. Our programs all have different data requirements, and our dream was to streamline this as much as possible, but we were really lost. And we didn't even know what was possible. So measuring the impact of our programs and the work that we do with clients and families has always existed for Woodville. And we know this because the approach aims to ensure best practice. However, how we do this and the level of focus our organisation placed on this it may always change due to different leadership or management or research and evidence that can be popular in the sector. And for us as an organisation, we actually did have a change in leadership and a partnership of new management. And in the team, the community initiatives team, we had 2 new managers, myself and another manager, community engagement manager, Sarah Montalongo. We saw the importance of our programs uniting to have a consistent framework to guide our work. And I guess from that, we even dared to dream about whether we could create an outcomes measurement framework. We noticed that this conversation was coming up quite a lot in the first year that we worked together, but it was never a priority. There was always something that came up that we needed to work on. We also saw that it was going to be a pretty big job, and time-wise and money-wise, could we actually commit to something like that? And I don't think we realised or could see whether this was possible. And that was until we actually attended a conference where we got to meet with for purpose evaluations. And we decided that we would move forward and have those conversations with them and really suss out, were they an organisation for us that could steer us in the right direction. And I guess a highlight for us has been building that relationship with for purpose evaluation. They've helped us start on this journey to feel supported by them and create a common language and define that common pathway so we can get to where we want to be. But I think also to identify that we haven't finished this journey as yet. We're still in that process.
Liz, I might just thank you. I have a million questions, but I might just